They laughed when the hospital janitor suggested checking the patient's airway. "Leave medicine to the doctors, sweetheart," the surgeon sneered, dismissing her with a wave. But when the patient flatlined and chaos erupted in the OR, those same hands that had been pushing a mop moved with surgical precision. What they didn't know was that Dr. Maria Rodriguez had once been the youngest trauma surgeon in the state, before one false accusation destroyed everything. Welcome to Secrets Never Told. Before we begin this story of hidden expertise and shattered dreams, tell me in the comments, where are you watching from today? And if you believe stories like this deserve to be remembered, hit that subscribe button and help us make sure they are. The fluorescent lights of Chicago General Hospital's third floor cast their familiar harsh glow across polished linoleum floors as Maria Rodriguez pushed her cleaning cart down the corridor at 5:47 a.m. The wheels squeaked rhythmically, a sound that had become as much a part of her routine as the weight of the industrial mop in her calloused hands. At 38, Maria moved with the quiet efficiency of someone who had learned to be invisible. Her graying black hair was pulled back in a tight ponytail, hidden beneath the regulation blue baseball cap that marked her as part of the environmental services team. The navy blue uniform hung loose on her small frame, chosen deliberately to avoid drawing attention from the medical staff who barely acknowledged her presence. She paused outside operating room 7, checking her watch. The morning surgical schedule wouldn't begin for another 2 hours, giving her enough time to complete the deep cleaning protocol that kept the ORS sterile and ready for the day's procedures. Maria unlocked the heavy door with her master key, a privilege that came with 3 years of spotless employment reviews and 0 security incidents. Inside the OR, she began her methodical routine. First, the floors, working from the cleanest area near the equipment to the dirtiest near the doors. Then the surfaces, wiping down every monitor, every instrument table, every piece of equipment with hospital-grade disinfectant. The work was thorough, precise, and performed with an attention to detail that her supervisors had noted but never quite understood. What they didn't know was that Maria's movements weren't just those of a conscientious janitor. They were the muscle memory of a surgeon who had once spent 12-hour shifts in rooms exactly like this one, where every surface, every instrument, every protocol mattered, because lives hung in the balance. As she cleaned the main surgical table, Maria's fingers traced the familiar contours of the equipment, the overhead surgical lights, the anesthesia machine, the monitors that had once displayed vital signs she could read as easily as a book. Her hands remembered the feel of these instruments, the weight of responsibility that came with using them. The OR door opened behind her, and Dr. James Morrison stepped inside, coffee in one hand, surgical schedule in the other. He was a tall man in his mid-50s, with the confident bearing of someone who had never questioned his place at the top of the hospital's hierarchy. His silver hair was perfectly styled, his white coat pressed and spotless. "Still here, Maria?" he asked, without really looking at her, his tone carrying the casual dismissal she had grown accustomed to. "Or 7 is scheduled for a trauma case at 8. We'll need this room ready." "Almost finished, Dr. Morrison," Maria replied quietly, continuing her work without meeting his eyes. "The room will be ready in 15 minutes. Morrison grunted acknowledgement and left to check on other preparations. Maria watched him go, remembering when she had been the one carrying surgical schedules, the one making decisions about OR assignments and patient care, before everything fell apart. 30 minutes later, Maria was restocking supply closets on the surgical floor when she overheard a conversation that made her pause. Dr. Morrison was talking with Dr. Sarah Kim, the chief of surgery, near the nurses' station. "The trauma case coming in at 8 is complex," Dr. Kim was saying. "Multi-vehicle accident, possible internal bleeding. Definitely going to need our full team." "Who's the attending?" Morrison asked. "Dr. Reynolds, but he's running late from another case at Northwestern. Won't be here until 9 at the earliest." Morrison frowned. "That gives us a problem. The patient is critical, and we can't wait an hour." Maria continued organizing supplies, but every word of their conversation registered with the precision of someone who had once lived and breathed emergency medicine. She knew the protocols, understood the challenges of trauma surgery when time was the enemy and every second mattered. "I'll take the case," Morrison said finally. "It's been a while since I've done trauma, but how hard can it be?" Maria's hands stilled on the supply boxes. Morrison was a skilled surgeon, but his specialty was orthopedics, elective procedures, planned operation, controlled environments. Trauma surgery was a different beast entirely, unpredictable, chaotic, demanding split-second decisions that could mean the difference between life and death. She wanted to speak up, to suggest they wait for Dr. Reynolds or call in another trauma specialist. But janitors didn't offer medical advice to surgeons. Janitors cleaned floors and emptied trash cans and stayed invisible. 20 minutes later, the trauma patient arrived. Maria was mopping the hallway outside OR 7 when the EMTS rushed past, pushing a gurney carrying a young woman, maybe 25 years old, with obvious signs of severe internal trauma. The EMT's voice carried clearly as they reported to the surgical team. Jessica Martinez, 24 years old, driver in a head-on collision, possible splenic rupture, definite internal bleeding, BP dropping fast. She's been unconscious since we pulled her from the vehicle. Maria's blood ran cold. The surname was coincidence, but the patient was close to her daughter's age. She watched the gurney disappear into OR 7, followed by the surgical team led by Dr. Morrison. For the next hour, Maria found excuses to work near the OR. She cleaned the same section of hallway 3 times, restocked supply closets that didn't need restocking, and generally hovered in the area where she could hear the sounds from inside the operating room. At first, everything seemed normal. The steady beeping of monitors, the quiet conversations of the surgical team, the controlled chaos of a trauma operation in progress. But gradually, Maria began to pick up on subtle changes in tone, slight increases in urgency, the kind of stress indicators that only someone with surgical experience would recognize. BP is still dropping, she heard a nurse say through the slightly open OR door. I can see the bleeding, but I can't isolate the source. Morrison's voice, tension creeping in. Maria's stomach tightened. She knew that tone. It was the sound of a surgeon encountering complications beyond his expertise, the moment when confidence began to crack under pressure. Maybe we should wait for Dr. Reynolds, suggested Dr. Kim's voice from inside. No time, Morrison replied tersely. She'll bleed out before he gets here. I can handle this. But from the sounds filtering out of the OR, it was becoming clear that Dr. Morrison was in over his head. The patient's vital signs were deteriorating, and Maria could hear the increasing urgency in the team's voices as they struggled with complications that a trauma specialist would handle routinely, but were beyond Morrison's orthopedic expertise. Maria found herself pacing the hallway, her janitor's cart forgotten. Every instinct she had developed over years of trauma surgery was screaming at her to intervene, to offer the knowledge and experience that could save this young woman's life. But she was just the janitor. Nobody would listen to her. Nobody would believe her. The sounds from the OR grew more desperate. Equipment alarms began beeping with increasing frequency. Maria heard Dr. Kim's voice, sharp with concern. James, her pressure is crashing. We're losing her. That's when Maria made a decision that would change everything. She knocked on the OR door, her heart pounding. When no one answered immediately, she pushed it open just enough to speak. Excuse me, she said quietly. I'm sorry to interrupt, but I couldn't help noticing the patient's vitals on the monitor outside. Dr. Morrison looked up from the surgical site, his face flushed with stress and frustration. Maria, this is not the time. We're in the middle of a critical procedure. I know, Dr. Morrison, but have you checked for a possible tear in the splenic artery? Sometimes in high-impact trauma, the bleeding can appear to be coming from the spleen itself when it's actually arterial. The OR fell silent. Every member of the surgical team turned to stare at the janitor standing in the doorway, wearing her blue uniform and cleaning supplies cart visible behind her. Dr. Morrison's expression shifted from stress to anger. I'm sorry, did our janitor just try to give me medical advice? Maria, I need you to leave this room immediately and let us do our job. But Dr. Morrison, leave, now. His voice was sharp, dismissive. Leave medicine to the doctors, sweetheart. Stick to mopping floors. Several members of the surgical team chuckled nervously. The scrub nurse shook her head with amusement. Dr. Kim looked embarrassed for everyone involved. Maria felt the familiar sting of humiliation, the same dismissal she had faced for 3 years. She nodded quietly and backed out of the OR, closing the door behind her. But she didn't leave. She couldn't. Instead, she positioned herself where she could continue to monitor the situation through the small window in the OR door. What she saw made her heart race with fear and frustration. Dr. Morrison was working frantically at the surgical site, but his technique was wrong for this type of trauma. He was approaching the bleeding as if it were a planned orthopedic procedure, methodical and careful, when trauma surgery required speed and decisive action. The patient's blood pressure continued to drop, and her pulse was becoming erratic. She's going into shock, Maria heard Dr. Kim say. James, we need to do something now. I'm trying, Morrison snapped back. The bleeding won't stop. I can't see where it's coming from. Maria watched through the window as the young woman's life slipped away on the table. Every fiber of her being screamed at her to act, to push through that door and take control of the situation. She had handled dozens of cases exactly like this one. She knew exactly what needed to be done, but she was just the janitor, just the woman who cleaned floors and emptied trash cans. Nobody would listen to her. Nobody would trust her. The patient's heart monitor began showing dangerous irregularities. Maria could see the panic beginning to set in among the surgical team. They were losing her, and they knew it. That's when the alarm alarms began blaring. The steady beeping of the heart monitor became the piercing wail of a cardiac arrest alarm. Through the OR window, Maria watched the line on the monitor go flat. "She's coding!" Dr. Kim shouted. "Start compressions!" The OR erupted into controlled chaos as the team began CPR procedures. Dr. Morrison stepped back from the surgical site, his hands shaking slightly as he watched his colleagues work to restore the patient's heartbeat. Maria couldn't take it anymore. She pushed through the OR door with authority she hadn't used in 3 years, moving with the purposeful stride of someone who belonged in that room. The surprised surgical team looked up as she approached the table, but before anyone could protest, she was at the patient's side, her eyes scanning the surgical site with professional assessment. "The tear is in the short gastric vessels feeding the splenic artery," she said firmly, her voice carrying the unmistakable authority of medical expertise. "The spleen itself is intact, but the arterial supply is compromised. You need to ligate the short gastrics and then repair the arterial tear with a running suture." Dr. Morrison stared at her in shock. "Maria, what do you have?" "Stand aside, doctor." "Morrison," Maria said, already reaching for surgical glove. "This patient is going to die if we don't act immediately." She snapped on the gloves with the practiced efficiency of someone who had done it thousands of times. Her hands moved to the surgical instruments with muscle memory that 3 years of pushing a mop hadn't erased. "Dr. Kim," Maria addressed the chief of surgery directly, "I need you to maintain pressure here while I isolate the arterial tear. Nurse Thompson, prepare a 4-0 proline suture and tell anesthesia to push 2 units of O-negative immediately." The surgical team stood frozen for a moment, caught between following the orders of someone they knew as a janitor and the growing realization that those orders were being delivered with the precision and authority of an experienced surgeon. Dr. Kim made the decision for everyone. "Do what she says," she ordered the team. "Now!" Maria's hands moved with surgical precision as she worked to control the bleeding. Her technique was flawless, her movements economical and sure. Within minutes, she had isolated the source of the hemorrhage and begun the delicate work of repairing the arterial damage. "Clamp," she said, extending her hand. The instrument was placed in her palm without hesitation. Suture, another smooth exchange. Irrigation. The surgical site was cleared, revealing the success of her repair work. As Maria worked, the patient's vital signs began to stabilize. The heart monitor showed a strong, steady rhythm. Blood pressure started to climb back toward normal ranges. "Bleeding is controlled," Maria announced, checking her work one final time. "The arterial repair is holding. She should be stable for transport to recovery." The OR fell silent, except for the steady beeping of monitors showing normal vital signs. Every person in the room stared at the woman they had known as Maria the janitor, who had just performed emergency trauma surgery with the skill of a seasoned professional. Dr. Morrison found his voice first. "Who are you?" he asked, his tone completely different from the dismissive superiority he had shown earlier. Maria began stripping off her surgical glove, the familiar routine of post-operative cleanup. "I'm Dr. Maria Rodriguez," she said quietly. "I was the chief trauma surgeon at St. Catherine's Hospital until 3 years ago." The revelation hit the room like a physical blow. Dr. Kim stepped forward, her expression a mixture of awe and confusion. "Dr. Maria Rodriguez, the trauma surgeon who was accused of—" She paused, clearly struggling with the memory. "The trauma surgeon who was falsely accused of drug use and negligent patient care," Maria finished for her. "Yes, that's me." The silence stretched painfully as the implications sank in. Everyone in the Chicago medical community remembered the case. It had been front-page news in the medical journal. A promising young surgeon, the youngest department chief in the state, brought down by accusations that had ultimately proven false, but only after her career had been destroyed. Dr. Morrison looked pale. "The charges were dropped. The evidence was fabricated. But by then, I had lost my license, my position, my reputation, and my livelihood," Maria said simply. "The medical board restored my license 8 months ago, but no hospital would hire a surgeon with my history, so I took the only job I could find that would let me stay close to medicine." She looked around the room at the faces of people who had dismissed her as just the janitor for 3 years. "I've been cleaning the same ORS where I used to save lives, listening to surgical cases I could handle in my sleep, watching patients suffer because of pride and assumptions." The young woman on the table stirred slightly, her vital signs strong and stable. The surgery Maria had performed would save her life. Dr. Kim stepped forward. "Dr. Rodriguez, I don't know what to say. We had no idea." "You weren't supposed to," Maria replied. "I needed the job, and I needed to stay invisible. Speaking up about medical cases would have blown my cover and cost me the only income I could find." She began moving toward the OR door. "The patient should recover fully. The arterial repair will hold, but monitor her for signs of secondary bleeding over the next 24 hours. Her blood loss was significant, so watch for signs of hypovolemic shock." "Wait," Dr. Morrison called after her. "Dr. Rodriguez, please. I owe you an apology. apology, more than an apology. Maria paused at the door. You owe that young woman a life, Dr. Morrison. That's all that matters. But what happens now? Dr. Kim asked. You just saved a life in my OR. You can't go back to being a janitor. Maria looked back at the surgical table where Jessica Martinez was breathing steadily, her color returning to normal. I don't know, she said honestly. I've been invisible for so long, I'm not sure I remember how to be anything else. She left the OR and returned to her cleaning cart in the hallway, her hands shaking slightly as the adrenaline of the surgery began to fade. She had just exposed herself completely, revealed the secret she had kept for 3 years. There would be consequences, questions, investigations. But as she listened to the steady beeping of the monitors through the OR door, indicating a stable patient who would live to see another day, Maria knew she had made the right choice. 20 minutes later, as Maria was mechanically mopping the same section of floor for the 4th time, Dr. Kim emerged from the OR. She had changed out of her surgical scrubs and wore the serious expression of someone preparing for a difficult conversation. Dr. Rodriguez, she said formally, could I speak with you privately? Maria nodded and followed her to a small consultation room used for speaking with patients' families. Dr. Kim closed the door and gestured for Maria to sit, then took the chair across from her. I need to understand what just happened, Dr. Kim began. You've been working here for 3 years as a janitor, and we had no idea you were a licensed physician. I needed work, Maria said simply. My savings were exhausted by legal fees during the investigation. When my license was restored, no hospital would hire me. The accusations had been front-page news. The exoneration was buried on page 12. Dr. Kim studied her carefully. The case at St. Catherine's. I remember reading about it. You were accused of operating under the influence and making medication errors that killed patients. All false, Maria replied. The investigation found that another physician had been stealing narcotics from the pharmacy and altering records to cover his tracks. When patients started dying from medication errors, he needed a scapegoat. I was convenient, young, successful, and without the political connections to fight back effectively. But you were cleared, 18 months too late. By the time the truth came out, I had lost my position, my reputation, and most of my professional relationships. Other hospitals saw me as damaged goods, too risky to hire regardless of my exoneration. Dr. Kim leaned forward. Dr. Rodriguez, what you did in that OR today was extraordinary. You saved that young woman's life when our team was failing. Your surgical skills, your diagnostic accuracy, your command of the situation, it was flawless. Maria said nothing, waiting for the inevitable questions about liability, insurance, unauthorized practice of medicine. I have a proposition for you, Dr. Kim continued. Our trauma department has been understaffed for months. We've been trying to recruit experienced trauma surgeons, but the good ones are already employed or won't relocate to Chicago. We need someone with your skills. Maria looked up, surprised. Dr. Kim, I appreciate the sentiment, but my history, your history includes 3 years of maintaining perfect employment records, security clearance, and professional conduct while working in this hospital. It includes surgical skills that just saved a life, and it includes the strength to survive false accusations and personal destruction without losing your dedication to medicine. Dr. Kim paused. I'm offering you a position as an attending trauma surgeon in our emergency department. Full privileges, competitive salary, and a chance to return to the work you trained for. The offer hung in the air between them. Maria felt tears threatening for the first time in years. The hospital administration won't approve it. The board of directors will never accept the liability risk. Leave that to me, Dr. Kim said firmly. After what I witnessed today, I'll fight for you at every level. We need doctors who can perform under pressure, who put patient care above politics, who have the courage to act when lives are at stake. You've proven you're that kind of doctor. Maria was quiet for a long moment, processing the possibility of returning to the life she had lost. There will be questions, media attention, other doctors who remember the accusations. There will also be patients who need the kind of surgeon you are, Dr. Kim replied. The choice is yours, Dr. Rodriguez. You can continue cleaning floors, or you can return to saving lives. Through the small window in the consultation room door, Maria could see the surgical floor where she had worked in shadows for 3 years. Nurses, residents, and attending physicians moved with purpose, carrying the weight of life and death decisions. It was the world she had been exiled from, the calling she had never stopped feeling. I'll need time to think about it, Maria said finally. Of course. But Dr. Rodriguez, don't think too long. We need surgeons like you, and patients need advocates who won't let them die because of pride or assumptions. That evening, Maria sat in her small apartment, still wearing her janitor's uniform, staring at the business card Dr. Kim had given her. The offer seemed too good to be true, too much like a dream after 3 years of invisibility and humiliation. Her phone rang. The caller ID showed Chicago General Hospital. Dr. Rodriguez Rodriguez. It was Dr. Morrison's voice, hesitant and formal. I hope I'm not calling too late. What can I do for you, Dr. Morrison? I wanted to check on you and to apologize again for my behavior today. My treatment of you was inexcusable, both professionally and personally. Maria waited, saying nothing. I also wanted to update you on Jessica Martinez, the patient from this morning. She's doing very well. Your surgical repair was perfect, and her recovery is ahead of schedule. You saved her life, Dr. Rodriguez. There's no question about that. I'm glad she's recovering. Dr. Rodriguez, I've been thinking about our conversation today, about assumptions and pride. I realized that I had dismissed not just your medical knowledge, but your worth as a person. I treated you as invisible, as less important than the equipment you were cleaning. His voice carried genuine remorse. I want you to know that I've recommended you for the trauma position, Doctor. Kim offered. I told the department chair that you're the most skilled trauma surgeon I've ever observed in action. Maria felt a lump in her throat. Thank you, Doctor. Morrison, that means more than you know. Will you take the position? She looked around her small apartment, at the medical journals she still subscribed to, at the surgical textbooks she couldn't bring herself to sell. 3 years of exile had not diminished her love for medicine or her commitment to patient care. Yes, she said, I think I will. 2 weeks later, Dr. Maria Rodriguez walked through the main entrance of Chicago General Hospital wearing surgical scrubs and a white coat with her name embroidered on the chest. Her hair was styled professionally, her posture confident, her manner that of someone who belonged in the medical environment. The transformation from invisible janitor to respected surgeon was complete, but not forgotten. As she moved through the hospital, Maria nodded to the environmental services staff, remembered their names, acknowledged their contribution. She had learned the value of every person who worked to keep the hospital functioning. In the trauma department, she was greeted by Dr. Kim and introduced to her new colleagues. Some recognized her name from medical journals and surgical conferences. Others knew her story of false accusations and professional redemption. All of them had heard about the life she had saved when everyone else had given up. Dr. Rodriguez, Doctor, Kim said as they concluded her orientation. Your first shift starts tomorrow at 6 a.m. Are you ready to be a trauma surgeon again? Maria looked around the trauma bay, at the equipment and monitors that had once been as familiar to her as breathing. She thought about Jessica Martinez, recovering at home with her family because someone had been willing to look past assumptions and see the truth. I've been ready for 3 years, she said. I just needed someone to give me the chance to prove it. Her first day back in surgery was everything she had dreamed of during those long nights cleaning floors. The familiar weight of responsibility, the precision required for life and death decisions, the satisfaction of using her skills to heal rather than just maintain. As she scrubbed out after a successful trauma case, Maria caught her reflection in the OR window. The woman looking back was no longer invisible, no longer dismissed, no longer hiding her true capabilities behind a janitor's uniform. She was Dr. Maria Rodriguez again, and she was exactly where she belonged. 3 months later, Maria was training a new resident in trauma procedures when she noticed a familiar face in the hallway outside the trauma bay. It was Jessica Martinez, the patient whose life she had saved on that fateful morning when everything changed. Jessica approached with her mother, both women smiling broadly. Dr. Rodriguez, I wanted to thank you personally for what you did. The nurses told me you're the surgeon who saved my life. Maria shook both their hands warmly. I'm glad to see you recovered so well, Jessica. How are you feeling? Perfect. The scar is healing beautifully, and I have full function. My regular doctor says your surgical technique was flawless. Jessica paused, looking thoughtful. I also heard about your story, about how you had been working here as a janitor when you saved me. That must have taken incredible courage. Sometimes we do what we have to do, Maria replied. What matters is that you're healthy and whole. But it's more than that, isn't it? Jessica's mother spoke up. You risked everything to save my daughter. Your job, your secret, your safety. You could have stayed quiet and let someone else handle it. Maria thought about that morning, about the choice between invisibility and action, between safety and doing what was right. Your daughter needed a trauma surgeon, and I happened to be one. The rest was just details. As they prepared to leave, Jessica turned back. Dr. Rodriguez, I'm a journalism student at Northwestern. Would you be willing to tell your story publicly? I think people need to know that heroes don't always look like what we expect. Sometimes they're the people we overlook, the ones who are right in front of us doing jobs we don't think matter. Maria considered the offer. Public attention had been something she had avoided for 3 years, afraid of reopening old wounds and inviting new scrutiny. But maybe it was time to stop hiding. Yes, she said finally, I think I'd like that. The article Jessica wrote about Dr. Maria Rodriguez became became a sensation in medical journals and local news. The story of the trauma surgeon who had been falsely accused, lost everything, worked as a janitor for 3 years, and then saved a life that exposed her true identity, resonated far beyond Chicago. Medical schools began using Maria's story as a case study in resilience and ethical decision-making. Hospital administrators reconsidered their hiring practices for physicians with complicated histories. Most importantly, other medical professionals who had been similarly wronged reached out to share their own stories and find support in rebuilding their careers. Dr. Maria Rodriguez had finally found her voice again, and with it, the power to change more than just individual lives. She had become an advocate for second chances, for looking past assumptions, and for recognizing that sometimes the people we need most are hiding in plain sight, waiting for someone to see their true worth. But every morning when she arrived at the hospital, Maria still nodded to the environmental services staff, still remembered their names, still acknowledged that every person in the building, from the most distinguished surgeon to the newest janitor, played a vital role in the mission of healing. She had learned the hard way that respect must be earned through actions, not titles. That true worth comes from what you do when no one is watching, and that sometimes the most extraordinary people are the ones everyone else overlooks. In the end, Maria Rodriguez had not just returned to medicine. She had returned to it with a deeper understanding of compassion, humility, and the recognition that healing happens not just through surgical skill, but through seeing and valuing every person who contributes to the work of saving lives. Have you ever been underestimated because of your appearance or position? Have you ever discovered that someone you dismissed actually possessed incredible knowledge or skills? Share your story in the comments below and let us know what city you're watching from today. Thank you for watching Secrets Never Told. If this story moved you, please subscribe and share it with others who appreciate tales of hidden expertise and second chances. These stories matter, and your support helps us tell them. Until next time, remember that extraordinary people don't always announce themselves. Sometimes they clean floors while dreaming of surgery. Sometimes they save lives while wearing janitor's uniforms. And sometimes the person you overlook might be exactly the one you need most.